Good evening, friends, and I extend my thanks for joining us on this important press conference. A lot of doubts are being created into the mind of public through unverified and unsubstantiated media reports regarding the execution of PMJ Sehat scheme in the UT of J&K. This press conference has been organized to bring the factual clarity on the matter before the general public. There is an allegation on the loss to the exchequer to the tune of rupees 500 crores. I would like to mention here that a total of premium that was paid to the Bajaj Alliance during the whole policy period, which began on 26th of February 2020 and continued till 14th of March 2022, including the interim period of 79 days on stop loss basis, was 304 crores. So the total premium that was paid to Bajaj was 304 crores. During this same period of 1 year and 79 days, the claims payout to the hospitals, both public and private, by the insurance company was rupees 398.41 crores. Given these figures, the allegation that a scam of rupees 500 crore has took place is without any evidence, as the company, instead of earning profit, has on the contrary incurred monetary loss of rupees 93.2 crores. There has also been an attempt to build a false narrative on the basis of baseless and wrong facts reported in some media reports about the termination clause of the contract. It has also been alleged that the review of the renewal of the contract was to be done after 2 years. It is clarified that as per the contract between Bajaj Alliance and the State Health Agency J&K, which was allotted to Bajaj after competitive bidding process using the model tender document issued by the National Health Authority, the maximum term of the contract was fixed for 3 years, which was renewable every 12 months. The provision of clauses 9 and 27 of the contract make it clear that the continuation of contract beyond the first year was to be on the basis of mutual agreement of both the parties and not otherwise. The insurance company, as per the terms and conditions of the contract, served the notice expressing unwillingness to continue the contract beyond completion of 1 year in view of the losses incurred by it. Every effort was made by the department at that time for ensuring continuity of the contract and services, but the company chose to exercise the option of exiting after the expiry of 1 year term. To prevent service interruption, State Health Agency J&K entered into an agreement with Bajaj Alliance to continue services on a stop loss basis until the selection of a new insurance company is finalized after invoking relevant provisions of GFR, namely Rule 166. As per the terms of arrangement, the insurance company would not share the risk of loss of claims, and the entire claims outgo would be borne by the government of J&K and the National Health Authority. The financial details underscore that the interim arrangement with 15% administrative charges as per the express guidelines issued by the National Health Authority was the most cost-effective option serving public interest during the transit period of 79 days. Out of rupees 124.27 crores released during this interim period of 79 days, only rupees 5.85 crores were paid as administrative expenses to the insurance company, and the balance amount of nearly rupees 119 crores was disbursed as claim fund to public and private empaneled hospitals. The interim arrangement with the existing insurance company continued seamlessly, benefiting over 69,000 individuals. This underscores the scheme's commitment to public interest. Contrary to misinformation brought out in the media reports, the interim arrangement had been thoroughly vetted by the Law Department, Finance Department, and the learned Advocate General, contradicting claims that the government had ignored the advice from its own departments. It has also been misquoted that the number of eligible families covered under the scheme was increased by more than 10 lakhs to benefit the insurance company during the interim period of 79 days. It is clarified that the number of families during the policy period of, that is from 26th of January 2021 to 26th of January 2020 to 25th of December 2021, and the interim period of 79 days which followed that period remained same as 21.24 lakhs. Hence, the allegation is refuted as being totally baseless and unfounded. The government of Jammu and Kashmir has diligently followed the guidelines of the National Health Authority, Government of India, for the scheme's implementation. This includes using the model tender document issued by the National Health Authority for transparent selection of insurance companies and adopting Health Benefits Package 2.20 version for implementation. The IT solutions developed by the National Health Authority are integral to the scheme's operation. Since the launch of PMJAY scheme, the government of Jammu and Kashmir has paid a total premium of rupees 1175 crores as on date to various insurance companies which were engaged from time to time. In return, insurance companies have disbursed a total of rupees 1,249 crores as claims to the empaneled hospitals. Rupees 642 crores have gone as claim to public hospitals, and nearly 600 crores have gone to the private hospitals for treatment of beneficiaries. During the implementation of PMJ and PMJAY, a total of 5.6 lakh patients have availed treatment for various conditions under the scheme, which inter alia include 21,557 cancer patients, and the cost on treatment of such cancer patients amounting to rupees 177 crores have been incurred under the scheme. Similarly, nearly 20,000 cardiac patients suffering with cardiac ailments have benefited under the scheme for an amount of rupees 170 crores on account of their treatment. Similarly, patients suffering from chronic kidney diseases who require frequent dialysis and other treatments, nearly 10,000 patients have benefited under the scheme. In the absence of such a scheme, most of the patients suffering from these life-consuming and life-threatening diseases could not have afforded such treatments which require prolonged medical management. The scheme's insurance model shifts the risk to insurance companies, as evidenced by them paying nearly 70 crores beyond the premium paid to the empaneled public and private hospitals. This model has not only strengthened the healthcare systems within the UT of J&K, but has also significantly reduced out-of-pocket expenses, preventing catastrophic payments and poverty for families in need of hospitalization. It has also positively impacted the health-seeking behavior and satisfaction of beneficiaries, creating employment opportunities in both public and private hospitals. For enhanced patient satisfaction, a feedback system has been introduced which is QR code based, and also the 104 call center has been used to reach out to patients to collect their feedback. And it is heartening to know that nearly 90% of the patients have rated the service that they have received in various hospitals as either excellent or good. However, it is worth noting that there have been attempts to discredit the scheme through misinformation. Such allegations are intended to disrupt the services and are totally baseless and false and meant to malign the image of government and are vehemently denied. Thank you.